Ever pondered how acid-base abnormalities in critically ill patients are evaluated? Perhaps the thought of how healthcare professionals decide whether to use arterial or venous blood gas analysis has crossed your mind. It's a fascinating subject and one that is crucial in the medical field, especially when dealing with patients in critical condition. Traditionally, arterial sampling has been the go-to method for evaluating acid-base abnormalities in critically ill patients. This is especially true for those being maintained on a ventilator. The reason for this is the precision of the arterial blood gas analysis, often abbreviated as ABG. It provides accurate and real-time information on the status of a patient's oxygenation, carbon dioxide production, and acid-base balance. This information is vital for the management of patients with acute respiratory distress and other conditions that require precise monitoring of oxygen and carbon dioxide levels. Now let's shift our focus to venous blood gas analysis, commonly known as VBG. This method is often used in emergency department settings where it has proven to be a valuable tool. Studies have shown that analysis of venous blood, particularly central venous blood for parameters such as pH, bicarbonate, lactate, base excess, and carbon dioxide pressure, or PCO2, are within 95% limits of agreement with arterial sampling. So, what does this mean? In simple terms, venous blood gas analysis can safely replace arterial blood gas analysis in many situations. This makes it a beneficial alternative as it is often less painful and carries a lower risk of complications compared to arterial blood sampling. However, it's important to note that arterial blood sampling is still necessary for accurate analysis of oxygen pressure, also known as PO2. In a nutshell, choosing between arterial and venous blood gas analysis is a matter of balancing the need for precision with the desire to minimize discomfort and potential complications. While arterial blood gas analysis is usually preferred for patients with acute respiratory distress or other conditions that demand exact monitoring of oxygen and carbon dioxide levels, venous blood gas analysis can be a reasonable alternative for patients with stable respiratory conditions who require less frequent monitoring. To sum it up, both arterial and venous blood gas analyses serve vital roles in the medical field. Each has its strengths and weaknesses, and the choice between the two often depends on the patient's condition and the specific information needed. The goal is always to provide the best care possible, making the most informed decisions based on the information at hand.